post-vagotomy diarrhea has been described. Again, we look at the role of probiotics seems to be quite interesting in these people, which could help in post-vagotomy diarrhea, because all the talks now go, if you have the next time you need to talk about gut microbiome, seems to be one of the biggest subject that is coming up. Late dumping syndrome, I don't think it is a major issue that we see in these people, but as I said, recurrence would be one of the things. Metabolic alterations are about 40% of the people at a later age, including the community prevalence, are diabetic, and diabetes has got a very, very big impact in the motility disorders which are associated here. So there are people who had a subtotal gastrectomy and continues to have symptomatic dyspepsia not amounting to dumping syndrome. These are the people who requires a lot of help. And the prokinetics, there are multiple prokinetics, and current safe prokinetic, if I am asked to say, is cinetarpride, which will help them very well in these people. Iron deficiency anemia is actually said to be one of the things, and we actually follow them up to pick up a new lesion, because those people who have a gastric carcinoma, not uncommonly a small number, could come out with a new neoplasm, a colonic malignancy, a little later. So we are very careful in screening them for other malignancies. There are elderly people who come with vertebral fractures because the calcium deficiency is shown, but then we don't know whether it is a causal relation or a temporal relation. And weight loss after gastric resection, we are again very careful with the nutritionist support. Gastric stasis and hurry, again, as I said, prokinetics alone could do wonders, because we have post-surgical referral where they say this patient has been continuously having two things, either a dyspepsia or diarrhea. Actually, they are actually helped by a mild prokinetic in the morning and a probiotic in the evening. We were looking at this new machine with some people to improve the gastroparesis. We do electrogastrography, and then if those people have significant gastric motility disorder, we could actually put a pacemaker like thing, the gastric pacemaker, and it did work in some people, but actually it is very good in diabetic gastroparesis. The issue of gallstones, which my previous speaker did mention, somehow doesn't seem to be a major problem. If you look at the community prevalence of gallstones and diabetic and gallstones, and probably post-gastrectomy gallstones, is not a major issue and is easily tackable. So one trickish question I always ask is, if a patient of yours who is a gastric carcinoma is going for a radical or subtotal gastrectomy, do you also do cholecystectomy? Is probably not a justified one. Bile reflux gastritis, we actually treat. Actually, these people get a sour eructations, and they get reflux, nocturnal reflux. And these people are reasonably helped by, again, prokinetics. And then again, we know all the treatment which we give for a gastroesophageal reflux disease are applicable them, and they do very well with sucralfate. So we take care of the nutrition part, which I was mentioning, by feeding jejunostomy. NJ tube placement is not a very favorite, and the post-op recurrence is what bothers. So whenever a patient who had a surgery and he goes for about 2-3 months and comes back for follow-up, we invariably do an endoscopy to pick up the possible recurrence. And I'm of the opinion that if a recurrence occurs, it occurs as early as 3 months. Biomarkers, this is where we have one project going on. We are working on a different, this one which is called the exosomes, and these exosomes may have some impact in picking up these diseases and prognosing these diseases. I'm thankful for the opportunity given. I don't know why Vijay called me, one of the smartest surgical guy which I know. We worked together for quite a long time. So thank you for calling me. I could meet so many people, and requested him to put it post-lunch so that half the people will go away. And we are now doing World Hepatitis Day after tomorrow, for a fantastic success that we got in the field of hepatitis with vaccines for all the virus. Thank you very much.